Hello, everyone, and thank you, Mara, for your introduction. Today, the presentation is about Lake Urmia and the institutional drivers and reasons behind lake's desiccation. You may have heard about Lake Urmia. It is the second hypersalinal lake in the world, which is so-called the twin sister of Great Salt Lake in Utah, and it is it is an indirect lake, which means the evaporation is the main outlet of water from the lake. There are 13 permanent rivers which flows toward the lake, and these are only inputs to the lake. As you could see here on the map, you can see here the number of operational dams, the number of dams which is under construction, and the number of dams which is going to be studied to construct the future. For those of you who are interested, Lake Urmia is a Ramsar site. Ramsar is just like an international environmental treaty, which is signed Ramsar in Iran in 1971. Ramsar Convention goal is how to worldwide loss of the wetlands. From 1970 to 2021, 57 dams were built in the basin, and the overall storage of those dams were over 2 billion cubic meters. And the main goal of those dams, firstly, was to irrigation, and secondly, supply drinking water. From 1999 to 2015, cultivated area using to supply water by dams increased by 87% in the basin. So, Lake Urmia has been experiencing hydraulic mission, obviously, because large-scale water infrastructure projects initiated in the dam in the basin, and it would amplify the expansion of agriculture, and these feedback loop continued. And as you could see here, this is the elevation of the lake, which is decreasing during the time. There was a study, and they found that the impacts of the anthropogenic factors is 4 times more than the climate change factors in the basin. So humans' role is predominant in that basin. So 5-year development programs serve as blueprints for Iran's advancement. Previous research concluded that development of hydraulic infrastructure in Iran is dictated by 5-year development programs. The question is here, what's the relationship between the goals of 5-year development programs as the overarching development program in Iran and desiccation and the boom of the dam boom in the Lake Urmia Basin? We used several resources for analyzing our research. Firstly, we used Bonyad Zarez research, which analyzed 5 years development with discourse analysis, with discourse theory, and also Bakhtiari, which did a compared analysis of 5-year development programs. Also, we used data from Ministry of Energy and Urmia Lake Restoration Program to do our research. To do that, we used the IAD framework, Institutional Analysis and Development Framework, and it focuses on understanding how institutions, both formal and informal, influence human behavior and shape the management of resources. Here, I just, for the sake of time, I'm just presenting the rules, which is just like 5-year development programs in our study. And it is worth mentioning that 94% of dams operationalized after enactment of the 1982 Fair Water Distribution Act and during various 5-year development programs. So During the first 5 year development program, it was after ending Iraq-Iran war, and the country needs to construction. And for this reason, the program was heavily relied on water-oriented development. And during that time, and the goal of the program was creating job, achieving food self-sufficiency, and enhancement of economic situation in Iran. So during that 5 year development program, 9 reservoirs with total volume of 370 million cubic meters were built in Iran, in the basin. The second 5 year development program continued the goals of the first 5 year development program, which again, it was water-oriented development program, and in that era, the greatest growth in investment in the agricultural sector happened. And for this reason, five more dams were built in the basin, and agricultural land use expanded about 14%. Third 5 year development program was the most intensive water-oriented development in the basin, because in that era, the Ministry of Energy focused more on extraction water and the building dam, and the greatest growth in the government investment in the agricultural development happened. During that era, 11 more dams initiated in the basin, and despite the fact that precipitation increased by 34% in the lake level dropped about more than 2 meters. However, this trend changed during the fourth, fifth, and sixth program, and the core of those programs were relatively protective regarding water resources. And for this reason, during the fourth 5 year development program, two new small projects, which their volume is ignorable, were built in the dam. And during the fifth and sixth year development program, no new dams projected initiated in the basin. You could see here the trend of the lakes level during these 5 year development program, and the expansion of the agricultural land in the basin. And also you could see here that the number of dams and the percentage of volume which was added to the basin. In the middle of the fifth 5 year development program, Iran's government initiated Urmia Lake Restoration National Committee, which its goal was reviving the lake. However, it wasn't successful, because after that you could see that the expansion of the agriculture continued in the basin. And there is a question here: what's the reason, despite the fact that this committee initiated to stop the laking stop laking drop, and by reduction of the agricultural expansion in the basin? What has happened that despite this initiative, the agricultural expansion continued in the basin? We could see here that there is a missing management link between the environmental consideration in 5 year development programs and the agricultural self-reliant aspiration. Despite the fact that 5 year development programs focused more on environmental issues, however, there are some paradox between different notes and articles of these 5 year development programs. But overall, they are trying to consider more environmental issues in the 5 year development program. However, the agricultural expansion in the basin continued, and this suggests that there is a prioritization of other objective, and for the government, achieving agricultural self-reliance, even it comes at the expenses of the environment, it is important to expand agricultural land use despite its environmental effects. So what are possible solutions here? The first policymakers should ensure coherence and alignment across different ministries to avoid predatory objective and resource allocation. Secondly, there should be there is a necessary that stakeholders and local policymakers should be involved in developing water resources planning planning and management programs in the basin, because right now all programs are up down, and the farmers have which are most majority of the water users, they don't have any role in water resource planning and management. Thank you so much for your attention. And this was all my presentation.
Can you hear me?
Yes.
Okay. Hi all, I'm Nuzrath Jahan. I'm a third-year PhD student here at the Environmental and Occupational Health Department at IU School of Public Health. My presentation today is more in general, sharing my experience in my journey of testing the waters in 2 different continents. So I am originally from Tamil Nadu, the southern, it's a southern state in India. It has a rich state, rich history, rooted in social justice movement, which is specifically called as a self-respect movement. In the picture here is Periyar and Anna. They are the stalwarts of the self-respect movement. I feel proud to share that this is my mother institution, Directorate of Public Health and Preventive Medicine of the state of Tamil Nadu, which has celebrated its 100th anniversary in 2022. That's where I come from, my hometown. I believe that this strong foundation of the state in public health has also deeply influenced my journey in public health, especially as I began exploring the intersection of water and health in both clinical and public health settings. I am a clinician by training. Despite being from a lower middle class background, I've been fortunate to be able to pursue a free medical education thanks to the education and social policies of my state, rooted in the social justice movement that I just mentioned. This is just me holding the liver and anatomical position, my first year lab repair, and my first time conducting labor. In 2015, I graduated from my med school. I had to take a 2 years break because I was down with tuberculosis. Then I took the government exam and joined the health workforce as a primary healthcare physician in a remote community healthcare center. As you can see, this is a small quaint town nestled between 2 hill ranges. As a clinician here, I encountered a higher prevalence of skin infections here, mostly because of the high concentration of tanneries industries here, and which was further complicated by indiscriminate groundwater pumping, which is prevalent across India and Tamil Nadu, but rampant in water-stressed regions, industrial regions like in Vellore and Alangaim. I work to notify these cases and help organize camps both inside and outside, both inside the community as well as in the factories for screening for skin infections. In 2019, I was posted in an urban primary healthcare center in the outskirts of the metropolitan city of Chennai, which is the capital city of Tamil Nadu. This community, they are still struggling from the aftermaths of the 2006 tsunami. And 2019 was one of the worst years for Chennai in terms of water stress. And they had to face the infamous 0 day where all major water sources for the city ran dry. And the city officials had to ply water trains from neighboring rural areas And this raised environmental justice concerns because these rural communities, they had to give up their own domestic and agricultural water, even though they had not contributed to this crisis. So alongside clinical practice, I have also been actively involved in public health activities related to education and community communication campaigns, which also includes communication campaigns for safe wash practices, water sanitation and hygiene practice, including menstrual hygiene practices. And these campaigns include both active and passive campaigns where we actively go to households and schools and talk to these people, but also we target passively to the patients who come to the hospital seeking healthcare. And based on my clinical as well as public health practice experience, I realized that I need to develop my skills so that I could properly document and verify these environmental observations, and which is why I pursued my Master of Public Health in Epidemiology and Health Systems from National Institute of Epidemiology. As part of this program, I had conducted public health projects, including public health situation analysis of drinking water in the city of Chennai, and public health and secondary data analysis of public health drinking water surveillance of the city. During my projects, I have worked closely with not just with the public health department, but also with Chennai City's Metro Water Supply Board. During field visits, I had accompanied the field workers. We visit local supply stations, we grab a map, we also actively update the maps as we undertake transect walks, and we sample waters across the supply chain, right from the overhead tanks until the last tap in the supply chain, and these taps are either public fountains, as you can see in this picture, or they are private within the households, but they are used by now for routine testing by the public health authorities. Based on the results and outcomes of my situation analysis, I proceeded to do a secondary data analysis of chemical and microbiological tests on Chennai's waters. And this data is not by the Metro Water Board. This is from the Public Health Department. Here, in the surveillance, by conducting the surveillance, the Public Health Department acts as an external quality control agent. I've also been involved in a project in central India where we tested drinking water as well as domestic drinking water as well as wastewater from domestic as well as a common village sampling points, and where we studied antibiotic susceptibility testing of E. coli isolates in these waters. And for one of remotest villages, these areas had high prevalence, almost 45% prevalence of antimicrobial resistance in their waters. And due to COVID-19, my further work in water was disrupted, but we were prematurely forced to take the role of acting epidemiologist in the cities. I was involved in Zone 8 of the city, Anna Nagar, handling 700,000 population. We do field visits, and the observations of which resulted in a publication and a podcast. During this field visit, we observe the efficiency of the public health interventions undertaken by the city's officials. We report on them, we give feedback to them, and we also conduct day-to-day analysis of their data, including the contact tracing data. Based on a field visits, we also give feedback to them for these interventions. Like in the initial stages, they used to put up banners and these barricades around households that are having COVID-19 positive persons. And then these were later given up when they realized how counterintuitive these measures were. Based on my clinical public health practice as an epidemiologist, as well as just a resident and citizen of India, I've come to realize how caste acts as a structural factor in influencing WASH outcomes. I can discuss this further maybe, but I'm skipping this. So I would like to contribute to addressing these structural issues soon enough. But for now, I'm here pursuing my passion I literally research it. We collect individual poop as well as we collect community poop, which means we collect wastewater. We run them through PCR, polymerase chain reaction, looking for specific enteric pathogens. As part of my PhD, I have been involved in a project studying the role of flies as enteric pathogen transmission vectors in Indianapolis. I also worked in a project looking at stool samples of Ugandan children with severe malaria, looking at the concentration of the plasmodium, that is a malarial parasite in their stools, and its association with concurrent enteric infections. But for my rest of my talk, I'll be focusing on this particular project. Giving a quick background on this, combined sewers are sanitary infrastructures that collect water, that take water from domestic sanitary sewage, industrial wastewater, and rainwater runoff. So during severe rainfall events, these sewers overflow, leading to which are called as combined sewer overflows events. These CSOs are bad. And these events happen in 32 states, and they discharge 850 billion gallons of untreated wastewater to the waterways. In Indianapolis alone, because of the state of the sanitary infrastructure, as little as 6 millimeters of precipitation could cause a sewer overflow, leading to 45 to 19 CSOs events per year in just Indianapolis. We know that this water is treated before consumption, and it looks obviously dirty, therefore preventing recreational exposure. But still, we are concerned about the links in the transmission chain. And here we are specifically concerned about flies, of how they connect a future victim with these sewer overflows. And because we know these flies feed on the sewers, and then they go on to be in contact with our food, the surfaces that we handle on a day-to-day basis. And this raises not only concerns of pathogen transmission, but also how these change the microbiome of the built environment in the short term and long term. With this rationale, we aim to determine the relationship between the CSO proximity and indicators of human feces in the flies. We also want to assess the enteric pathogen profile of the flies near CSOs. The study was conducted in 16 to 17. Our collaborators measured the distance between sampling events and CSOs. And the specific sampling site, Military Park, has almost all of the CSO events within 2 miles of its radius, whereas the other sampling sites had almost nil CSOs in its proximity. And they proceeded to sample the flies, dissect them aseptically, remove their alimentary canal, and extract DNA, and then look into this DNA for 16S gene through PCR amplification. And also they proceed to look for other host-specific markers. They wanted to check whose feces it was, whether it's human feces, canine feces, or any other animal feces. And after all these tests, the sample is handed over to us from Indianapolis to Bloomington. We store the samples in our -80 freezers, and then we carried out a 40-cycle pre-amplification in regular thermocyclers. And then we do then we use our TACMAN array cards in Quant Studio 7 to analyze or to look for 48 enteric pathogens. So these are customizable cards. Rather than looking for one particular enteric pathogen, we look for 48 targets simultaneously. This is the results, and this is flies carrying feces. And this is the proportion of human genes in those flies. We see that a high proportion, almost 20% of the flies carrying feces, tested positive for human genes when they were less than 1 mile, when they are less than 1 mile of the CSO events, that is the sewage overflow events. And this is the profile. We see that at almost 50% of our samples, that is our flies, tested positive for at least one pathogen. The pathogen profile was usually what is expected. It's positive for Klebsiella pneumoniae. It has high prevalence of, a high proportion of samples tested positive for Klebsiella, E. coli, Shigella, and those stuffs. But what was surprising was we had positivity for helminths, soil-transmitted helminths like strangulites, and also positivity for Salmonella enterica. this would be normal in India, it would be an everyday event, but in US, it's a big deal. This specific GIS analysis was conducted by another of our collaborators, and we found that every 1 kilometer increase from a CSO event is associated with a 4.6% reduction in risk of visiting a hospital for gastroenteritis. Gastroenteritis is mostly diarrhea, vomiting, and such symptoms. So based on our results, we concluded that flies are feeding on human fecal waste from these sewage overflow events in urban cores of cities in the United States. And a household's proximity to a CSO discharge point may increase its risk of acute gastroenteritis. We also verified this with CDC data from 2016 and 17, and we found confirmed cases of Salmonella enterica serotyphi reported during this time. We also conclude that flies may act as composite samplers of environmental fecal contamination, and flies have high potential to transmit these enteric microbes. Based on our results, we recommend producing barriers at various points across this transmission chain. So we recommend reducing fly breeding sites, which is preventing sewage overflows, and also practicing safe wash practices like adhering to hand hygiene, preventing contact with foods or surfaces that might lead to human exposure, and surface disinfection. We also recommend adopting a One Health approach, because this is not just human feces that tested positive for enteric pathogens, but also dog poop and other animal feces. So we recommend collaborating and communicating across different sectors and disciplines. And we also recommend that flies could be used as a complementary option for public health surveillance in these areas with environmental fecal contamination, but low resource settings. So instead of testing wastewater or human samples, we could use flies as a composite environmental sampler. Our limitation is that these are molecular methods, and therefore they cannot determine if the pathogens were viable and infectious at the time and point of sampling. And we also did not directly assess human exposure to flies or contaminated food or surfaces. And I'm concluding my talk here by acknowledging that I'm still a work in progress. This is me, right from my fancy dress competition as a doctor to realizing my dream and still progressing. And with every day, I keep reiterating myself that science as an endeavor is per se science as a practice is a political endeavor, which is why I'm also associated with the Science for the People, an organization of scientists and activists that tries to build power both inside and outside institutions to help make science truly for the people. Some of us are hoping to start a local chapter for SFTP. Happy to discuss about that as well as about my presentation. Thank you.